are dealing with very patients. So we'll be having a discussion. So I'll ask the question one by one, and then we'll proceed with our discussion. And at the end, we can have the question and answer session. So the first question is, studies suggest that in a large number of people, even before it manifests as anemia, there can be an iron deficiency. So considering this, when should we suspect an iron deficiency? And would you please guide us in this matter?
I'll take that question. Thank you, Dr. Yogita. First of all, for starting the discussion with that question, the very fact that we are talking about iron deficiency versus iron deficiency anemia, that itself is very important to be aware of. It's often a very neglected area because we are always looking for anemia. Nobody's looking for iron deficiency usually. So first of all, iron deficiency without anemia, it's also sometimes called non-anemic iron deficiency. The main difference between that and iron deficiency anemia is anemia. So you don't find any decrease in hemoglobin when there is no anemia. But what happens is that the iron stores may be reduced. So we must also keep in mind that this iron deficiency may be absolute or functional. Absolute when there is an absolute decrease in the stores, but it could also be a functional iron deficiency where the stores may be normal, but the requirements may not be met by the available stores. So absolute or functional, both these things we should keep in mind. Now coming to the question, when do we suspect iron deficiency? So, in my opinion, iron deficiency should be suspected in 3 situations. The very first being when a person or a patient presents to us with very non-specific symptoms like fatigue or generalized weakness. These are one of the very common symptoms which patients with iron deficiency without anemia can present with. Then there are other symptoms like irritability, headache, lack of concentration, restless leg syndrome. Some people also have weight gain. Then they may have alopecia, pica. They could have glossitis. One other peculiar situation is when you have a patient of hypothyroidism whose symptoms are not improving with the thyroid medication. Then also you should suspect. So the first situation is when you find these non-specific symptoms in a person. So look for iron deficiency there. The second situation is when you actually expect it. So when you know that there is a risk factor for iron deficiency anemia, look for iron deficiency even if you do not find any anemia on clinical examination. So these risk factors would be whenever you are suspecting any problems with either an intake or an increased requirement or a loss for some reason, and maybe that will be taken up sometime later. So that's the second situation, when you're expecting it. Now the third situation is actually, that's like a bonus, it's when you least expect it. So like nowadays you find patients, even persons, not patients, routinely doing blood investigations. People keep doing investigations whenever they feel like it. So don't neglect that. If you come across the CBC, just look at the MCV and the MCH. If these two are reduced or you find a declining trend over time and the red cell distribution width is increasing, then keep in mind again that you should suspect iron deficiency and investigate accordingly.
Okay. So I will take this question. Madam said that most of us are aware that iron is required for the production of hemoglobin, and therefore a deficiency of iron usually leads to anemia. And this is the most common symptom of iron deficiency is anemia. And most of the signs, but we have seen that most of the signs of anemia are due to the iron deficiency and not necessarily due to the anemia itself. Now, why is that? I'll just give a few of the reasons where iron is important besides being only in the hemoglobin. The first is the myoglobin. This is oxygen storage which is present in the muscle. These are the oxygen transport protein that is there in the muscle. And as Madam has mentioned that when there is a deficiency of iron, the myoglobin obviously is less, and so that leads to easy fatigability and weakness. Also, the iron is required in a lot of enzymatic processes like the oxidative phosphorylation and the cytochromes, where it forms, as a cofactor and as hemoproteins that are there. So that can be affected if there is iron deficiency, and that is the main source of energy production, the electron transfer, right? So that also can lead to problems. The third thing is it's required in the DNA synthesis. So it is very much involved in the cell cycle. And this is evident in the chelosis and the glossitis, the ball tongue that we see when there is an iron deficiency. This is a sign of iron deficiency anemia, but these are because of iron deficiency that it's seen in other cells also. Iron is also required for boosting the immune system. It's required for the production and also maturation of the white blood cells like the lymphocytes. And therefore, when there is an iron deficiency, you see that the immunity goes down and they are more susceptible to infections. Iron also plays an important role in the balance of the neurotransmitters like the dopamine and serotonin, and that leads to a lot of mood fluctuations and the depression also. It is also involved in leptin and ghrelin production, therefore it affects the appetite regulation. The other thing is that iron is required for the conversion of T4 to T3, where one iodine is removed and it becomes T3. And that is the active form of thyroid hormone. And when iron is not available, usually this suffers, and therefore patients will be suffering from inadequate thyroid hormones. Last but the penultimate one is that iron is required for the production of collagen, which helps in the elasticity of the skin. So when iron is not there, the skin becomes dry, rough, and wrinkling is there. It's also involved for the hair production, the hair growth. And there is this condition called as telogen effluvium, and that is seen, where you lose lots of hair at a time. That is seen in iron deficiency, where the hair growth, kind of stops. It is resting, and so there's a lot of hair fall that is seen. And iron is also involved in the melanin production, into the hair. So that's why premature graying of hair is seen in iron deficiency. Last but not the least, that's the restless leg syndrome. It is usually seen that when people are suffering from this, there is very low ferritin levels in the body. So that is another part where iron deficiency plays a role. So these are the things other than anemia where iron deficiency can affect the human body.
Hi, good evening, everyone.
Good evening.
Coming to what group of people are more susceptible to, it is the women, the children, and the adolescents. So in various studies, it is shown that in this group, the prevalence of anemia is more than 50%. In fact, in the adolescents, in certain studies, it can be as high as 68 to 70% prevalence. So apart from men, all the women, children, adolescents are considered to be the high risk groups. Now, why is it so? Rather, what are the risk factors which makes anemia so prevalent? The commonest one is iron deficiency. That's a nutritional deficiency of iron. Now, it can be, of course, poor dietary intake. And here again, a vegetarian diet has been to some extent, blamed because of the poor bioavailability of the vegetarian sources of iron. If they are not adequately supplemented, that is, if you take adequate amounts of iron-rich foods in a vegetarian diet, it could very well compensate for the needs. But however, if this is not taken care of, you have nutritional deficiency. It can also be because of a relative deficiency. For example, in children, in adolescents, it is their rapid growth which requires a higher amounts of iron, and that has to be compensated with adequate nutritional intake. And in very young children also, if they are born to mothers who have had poor nutritional pregnancy course, so they may be born with again poor iron stores, which can again make them very vulnerable to iron deficiency very early on in their lives. And in adolescent girls especially, and in the women in the reproductive age group, it is the menstrual blood loss which invariably is considered to be the most common reason for the iron deficiency. And in pregnancy, again, there is a significant volume expansion and hemodilation and an increase in the demand. And if this is not adequately compensated, you can develop an iron deficiency anemia. So the common factors in all these these high risk population seems to be nutritional deficiency and relative increase in the demand at various stages of life. Then, of course, we can have the other common causes are in our Indian context. It can be parasitic infestations, which can give rise to gastrointestinal losses. There can be gastrointestinal losses due to other causes like ulcers and infections, and even inflammatory bowel disease like Crohn's disease or ulcerative colitis, and use of NSAIDs and all that, which can give rise to very subtle blood loss that can happen, which may go unnoticed. So that is apart from nutritional deficiency. Here we are talking about increased loss, either due to various GI causes, commonest being parasitic infestations and chronic infections. Then, of course, there are conditions like chronic kidney disease, which can also give rise to, and which are again risk factors for iron deficiency anemia. So nutritional deficiency due to poor intake and increased demand in pregnancy, in adolescence, in childhood, parasitic infestations, chronic infections, increased GI loss are the common reasons, risk factors for iron deficiency. Thank you.
Yeah. Thank you, Nitesh, for the question. So RDA, that is recommended daily allowance of iron. It varies as per the age and gender. So as per the ICMR's N9 report on nutrient requirement of Indians, which was published recently in 2020, the requirement of iron in the adult male is around 19 milligram per day. And in women, it is 29 milligram per day, as women are menstruating and there is a significant amount of blood loss during menstruation. During pregnancy, as there is rapid increase in the expansion of the tissues and red cell, there is increased requirement of iron in pregnancy as well. So the recommended daily allowance during pregnancy is 40 milligram per day. During lactation, it is 23 milligram. And in the children, in the infants of 6 months to 12 months of age, the requirement is around 3 milligram, and it increases as the age increases. So it is maximum during adolescent phase, as it is a growing phase. During adolescence, the requirement is around 28 to 32 milligram per day. So most of the habitual Indian diet usually contains the adequate amount of iron. But the problem is about the absorption. So usually only 5% of what we eat is being absorbed through the gut. There are various factors which are actually responsible, and this might be the very factor which is responsible for the widespread prevalence of anemia in the community. The factors which are responsible ranges from presence of inhibitors of absorption like phytates or oxalates, which are usually present in the combined diet which we are taking, or presence of the promoters. Like if vitamin C is there in our diet along with the iron, the absorption will be better. Also, if there are presence of other diseases such as celiac sprue or celiac disease, then absorption will be less. So this absorption also depends on the demand. So if in case of pregnancy, when the demand is more, the absorption rate are also increased. So there is a mechanism which are useful or beneficial in the pregnancy, which can take care of deficiency of iron during pregnancy. And there is also one another interesting feature about the iron metabolism is about conservation. That is, when RBCs are broken down, the iron present in these RBC are recycled and reutilized in the formation of new red cells. So that's why even though there is slight deficiency through the diet which is being consumed, these mechanisms are there to take care of the requirement of iron. Although the diet of Indian diet has all the required amount of iron, but if proper care is not taken, and in the cases of rapid growth such as adolescent, in the children and in the pregnancy, we need to supplement iron through the supplementary tablets. So as we all know, Government of India is running various prophylactic programs. So nowadays there is this Anemia Mukta Bharat program, in which the supplementary iron, it may be weekly or bi-weekly tablet, which is given to the adolescent age group, children's, as well as pregnant women, so as to take care of deficiency disorder. But if we plan our diet properly and we include the iron-rich food items and include the food items which will promote the absorption of iron, then there is no need of any external supplementation in other age groups. Thank you so much. Nitesh, over to you.
Thank you, ma'am. And very well said. You especially that last part. We will come to that part also, how to enhance iron absorption and reduce anti-nutrient factors. But now I would like to ask Suvita, ma'am, that there are two types of iron can be found in food, that is heme iron and non-heme iron. So heme iron can come from animal sources, whereas non-heme iron comes from a plant-based diet. So ma'am, can you elaborate us on their sources?
Yeah. Good evening, everybody. Iron is, like as Dr. Nitesh said, it's present in two forms. Heme, which is also called as the organic iron, which is well absorbed. So the absorption is like around 15 to 25% of what we take through heme iron sources is absorbed. Whereas non-heme iron, the absorption rate varies from 5 to 20%, basically because of presence of inhibitors which influence absorption of non-heme iron, which will be discussed. So as said, heme iron is present mostly in red meat, fish and poultry, and non-heme iron is through plant sources, which includes pulses, grains and fruits. But we are focused on plant-based diet, and we need to advise our patients and people more towards plant-based sources, and we are also going to suggest them about how to enhance or better how non-heme sources of iron could be better utilized and absorbed in the body. So NI in Hyderabad, the non-heme sources of iron which are mentioned is amaranth per 100 gram contains around 27.3 milligram of iron. Bajra has around 8 milligram per 100 grams. Peas has 7 milligram per 100 grams, and chana dal has wheat. They all have around 5 milligram per 100 grams. So these are the sources which are mentioned, non-heme iron sources mentioned by NI in Hyderabad. from other references which are relevant to Indian situations, I found that coconut milk has around 1.5 cups of coconut milk has around 4.3 milligrams of iron. Cooked soya bean has half cup has 4.2 milligrams. Ragi has 3.9 milligram per 100 grams. Pumpkin seeds roasted form has 3.9 milligram per 30 grams. And the fresh and boiled spinach, 1 cup has 3.2 milligrams of per cup of non-heme iron. As said, heme iron sources are mostly from non-vegetarian sources. Okay, other sources of non-heme iron include chickpeas, spinach, I've told, onion stalk, mustard leaves, fenugreek leaves, mint, lentils, gingerly seeds, gram dal, plantain, the green plantain, black gram dal, and pumpkin. So I said this that the enhancers which help, vitamin C is one of the enhancers. So sources of vitamin C include gooseberry, cabbage, drumstick leaves, and coriander leaves. Thank you, and over to you, Dr. Nitesh.
Thank you, Dr. Yogita, and good evening, everyone. Yeah, it's a whole food plant-based diet definitely can meet the iron requirements, but more care and a good planning is needed to meet all the required iron needs. So one should be aware of we have to include more of iron-rich plant-based foods, as well as aware of the anti-nutrients. And the anti-nutrients, as the name suggests, it impairs the nutrient absorption from the intestine, from the gut. And these anti-nutrients, they are naturally occurring compounds which are found in our food. And these form complexes with the minerals and impair their absorption. So with regards to iron, the major anti-nutrients are phytates and polyphenols. So phytates are found in whole grains, in legumes, oil seeds, and nuts. And these chelate with iron and form insoluble complexes, and that is how it impairs the absorption of iron. And the way we can reduce its content in food is by if we soak suppose the legumes and whole grains overnight, or even like sprouting or fermenting like sourdough bread or like our idli dosha. So these are good ways to reduce the phytate content, and also boiling also helps to reduce the phytate content. Also adding like enhancers like ascorbic acid, as Dr. Yogita mentioned before. That also helps to for the better absorption of iron. Then coming to the next, the polyphenol like tannin, which is found in tea, coffee, in cocoa, in some beans also. So this also impairs the absorption of iron, and the way we can reduce its effect on iron absorption is by mainly like in the tea, coffee, how we do, boiling it helps to reduce the tannin content. Then the third group of anti-nutrient is calcium mineral. So this impairs the iron absorption, which is found in most of the dairy products, as well as the calcium supplements. So we have to be careful that we should not be including it with our large meals. It's better if we have them in between the meals. Same way, before I forgot to mention, tea, coffee also is best to avoid the caffeine, but yeah, in between the meals, if we have them, that is the best strategy. The next group would be the lectin group, and that is found in whole grains and legumes. Especially peanuts are very rich in lectin, and the way we can reduce it is by soaking them, by boiling them, and the fermenting also helps to reduce the content of lectin. Then some proteins like egg albumin or casein or soy, like isolates of soy protein, This also inhibits iron absorption, and definitely we tell to avoid animal products and dairy. So that would be the best strategy. Then last but not the least is the oxalates. So oxalate, how it like impairs iron absorption. Also, it impairs the like it goes and binds with calcium. So we know that oxalates do increase the formation of renal stones. Same way, it's not good for iron absorption also. And the best strategy would be to reduce like food. The food where we find oxalates more is the like spinach, rhubarb, or some legumes also are rich in oxalates. So the oxalate rich foods, it's better to reduce them in our major meals, as well as if someone wants to take them, then best strategy is to like cook them properly, like boiling or steaming or blanching is the best strategy. So it's possible on whole food plant-based diet to get our required iron, but we have to take care like how the anti-nutrients by using proper food preparation methods, by adding the enhancers, or the timing of the like how we take these anti-nutrients. And over to you, Dr. Yogita.
Yogita. So, first of all, I think it's a very wonderful topic to begin with because iron deficiency is so prevalent and so important in our country. So, the vitamin C will facilitate the conversion of the ferric ion to the ferrous ion, and it will make complexes which are very easily transported through the intestinal mucosa. So apart from that, it has an antioxidant effect, and that is also helpful for absorption. So it's not just about increasing the absorption. Vitamin C can actually counter the effect of many anti-nutrients. So, for example, phytates, phytic acid, and even polyphenol. So many of the ones mentioned earlier. So vitamin C can selectively counter the effect of these anti-nutrients. It can vary from a phytonutrient to phytonutrient. It can vary from anti-nutrient to anti-nutrient. So, for example, for phytates, it's more effective than compared to polyphenols. Now, polyphenols are still available there in our food in very small amount, and they are very important for our metabolism because they reduce the oxidative stress. But many of them will interfere with the absorption of iron, like tea or coffee that Dr. Silja mentioned. So we need this is a dose dependent impact, because if we are taking small amounts of vitamin C, we will have lesser impact on iron absorption for any of these anti-nutrients, or even without this, even for the normal absorption of iron. So this is so we need to also keep in mind that we need to have a good amount of vitamin C, or combine good vitamin C rich foods in our diet. So, for example, if we just add some lemon juice to dal, we will be facilitating the dal or beans, which are giving us our iron, which are an iron source. We are going to be facilitating the iron absorption. Similarly, having gooseberries, amla, in any form along with our food is going to be very helpful. Add some strawberries or kiwis to your cereal, more absorption. Add some peppers to spinach leaves, add some lemon juice, there you have a very good combination. Tofu, where the availability of iron is there, but it's the absorption is poorer. Add some broccoli, again, drumsticks. fruits like apples, kiwi, citrus fruits, even dry fruits like figs, dates, prunes, raisins. They're all good sources of vitamin C, and combining these vitamin C rich sources in our diet is very important. So meal planning becomes very important, especially to, if not just, on a normal basis, but especially more so if one is iron deficient. And apart from this, from the supplement part also, we can combine vitamin C with the supplements. But one newer research is now telling us that even prebiotics are helpful. So galacto-oligosaccharides and fructo-oligosaccharides have been showing promising results, and they have in various studies shown the 10% to 60% enhancement of iron absorption from ferrous fumarate mainly, and then ferrous sulfate also. So these are, this is another very promising thing. They modulate the gut microbiome and thus improve the iron absorption. It's a complex process, but yeah. So these are ways in which we can add on the iron enhancers and iron absorption enhancers and improve the overall intake from the whatever we are eating.
Thank you so much, ma'am. Thank you so much.
Thank you. Thank you. Yeah.
Really, absorption and the enhancer and the inhibitor, we really need to know more about it. So Dr. Achyutan asked me to intervene this answer as well in between. So please, over to you, Dr. Achyutan.
You, Dr. Shruti, and thank you so much, Dr. Anjali. It was so beautifully explained with all the mechanisms. I learned something new in what you shared, and you covered the entire thing. And I'd like to share a small story to support your point of how traditionally in India, we've always combined high vitamin C foods with high iron foods without even realizing it. The beauty of our practices. In any banana leaf meal, you go to a wedding, you sit down and they serve a banana leaf and you wash it and they start serving dishes. Originally, the first item to be served on that leaf is always a fresh fruit. It can be any fruit, usually it's a peeled banana, but any fruit. A fruit, and then the salad, the kosamri, and then all of the cooked vegetable dishes, and then the rice, and then the sambar, and all the other dishes later. And when we, eat it this way, like Dr. Anjali said, you combine fruits with the high iron-rich fruits that you're eating, your absorption gets boosted. That's number one. And number two, if you observe any traditional recipe, say the recipe that your mother always cooked with rice, what's the side dish, whether it's sambar or roti and dal or dal chawal or rajma or chana. These lentils, pulses, legumes are some of the highest iron-rich foods in the plant kingdom. And you would notice that pretty much all of those foods would have lemon juice squeezed in it. One of the things that lemon juice does is boost this iron absorption, so that combining having fruits with your meals, having some salads with your meals, adding lemon juice to your dals, those are some amazing traditional ways by which you take this, the scientific knowledge and practically implement it, like Dr. Anjali was sharing. Thank you so much, Doctor.
Can I add to that? Yeah. So, even things like moringa leaves and small amounts of these foods makes a big difference, because we add.
Absolutely, and thank you for asking that, Dr. Through this entire discussion, we've been focused on iron deficiency for a good reason, because so many people in India suffer from iron deficiency and iron deficiency anemia, and its crazy dangerous side effects and complications. But iron is a double-edged sword, and this is the reason why the source of iron also matters a lot. In India today, although we have a lot of iron deficiency, our top causes of death, the reason why most of us might die, is heart disease, diabetes, cancer, and such lifestyle diseases. And what happens when you consume too much iron, especially from unhealthy sources, is your risk of these diseases starts going up. This was discovered in the 1980s, and we thought that it may be because iron increases oxidation. So, when you talk about heart disease in the blood vessels of the body, you know that cholesterol gets deposited and forms plaques, and then that causes a heart attack, right? But not all the cholesterol just gets deposited. It's mainly oxidized cholesterol. Cholesterol gets oxidized and then gets deposited. And that's what leads to, the higher risk of a heart attack actually happening. And when you look at what does iron do when you consume it, when it's in your body, it acts as a pro-oxidant is what we used to think. And then when they analyzed, when you consume so-called heme iron, which is the iron found in hemoglobin in your blood, in other animal foods like meat, for example, would contain heme iron. So when you consume more heme iron, the more you eat, the higher your risk of these diseases. For example, if you consume 1 milligram a day, excess heme iron, more than what you need, you have a 27% increased risk of heart attacks. You have a 16% increased risk of diabetes and a 12% increased risk of cancers. These are diseases that we want to avoid. So should we not be consuming iron? But then last half an hour, we've been talking about how iron is important. So we started doing more and more research into this. Is it really the iron, or is it just because we are eating iron that comes from meat? What's really causing this problem? So what did a group of scientists do? They took a bunch of people and they did something very interesting. They removed some blood from their bodies to see what happens, because iron is there in hemoglobin. Hemoglobin is in the blood. So if you want to reduce the amount of iron in the body, then remove some blood. So they removed some blood from the bodies to see what happens. Do their heart disease risk drop? Does the heart disease get better? They found that heart disease risk, there was no change before and after. No matter whether you remove blood or not, heart disease risk didn't change much. But then what they found very interesting, cancer risk dropped significantly. I think there was something like 37% reduced risk of cancer. And this is something that we've seen in some other places also. For example, if you get a blood transfusion, for some reason you had blood transfused into your body, your risk of cancer goes up in the months following that blood transfusion. There are some people with some conditions where you bleed into the ovaries. And they have increased risk of ovarian cancer. There is a disease called hemochromatosis, which is a storage disease of iron, where too much iron gets stored within the body is not able to let go of it. And those patients have a whopping 200 times increased cancer risk. So this we found to be a very close link. The more iron in the body, the higher your risk of cancers. So what do you do? Should you eat a lot of iron? Should you eat a lot of meat to get that iron, and then go and bleed somewhere and then end up with anemia or cancer? Now you're trapped between these two. You don't know what to do. Research has also found the answer. They found that when you consume your iron from plant-based sources and not animal-based sources, you get the best of both worlds. You're able to get enough iron to prevent anemia and perhaps even to overcome anemia in some patients. At the same time, you don't end up with an iron overload, and you don't end up with that increased cancer risk. So the solution is to focus on non-heme iron sources from whole food plant-based sources and enjoy the best. Of both worlds. Thank you so much for that question.
Thank you so much, Dr. Nitesh. Actually, diet plays an important role in every stage, or right from mild forms of anemia. So in all stages, I think diet plays a major role. How it complements pharmacological therapy. So first, first important role is it enables dietary sources to complement the supplements so that the body reserves, no, it is building up. So one of the important roles is to build up the body reserves. That's where dietary sources play an important role. The next important thing we were all talking about is like how foods, they interfere with the iron absorption. So what happens is when we advise on proper diet, that will interfere with the food absorption and also the prescribed supplements. So even that is also affected, right? So we need to educate the patients about the foods which will prevent the iron absorptions. That is the role of advising on diet during the treatment of anemia. The third important thing is it will prevent interaction between food and iron supplements that can aggravate adverse effects. So that is another important role. And so it will also teach patients about the importance of diet, so that after therapy they will continue, like even after therapy, patients will continue to take iron rich foods, which will prevent recurrence of anemia. So for every stage of anemia, I think dietary advice plays an important role in complementing the treatment, pharmacological treatment for anemia. Thank you.
Thank you, ma'am. So now I would like to summarize today's session. So iron, the as today's topic is the restoring the bread. That is the role of plant-based diet in iron deficiency anemia. Surely, the iron deficiency is a big problem that many states of India is facing right now. Not just iron deficiency anemia, but even the rates of iron deficiency itself are high in many parts of our country. So to deal with this problem, we have to think properly, and the most important factor that can help us to deal with this situation is our diet only. So by incorporating plant-based diet, and that is balanced one with a variety of food items like grains, legumes, different types of fruits, and green leafy vegetables, we can increase our iron intake. But when we talk about iron iron from plant sources, so the main question arises about their bioavailability. So the two main factors that affect this, the one is uh, anti-nutrients, and other are the enhancer. So anti-nutrients that reduces bioavailability of iron. So by using simple methods like fermentation, boiling, sprouting, and even some mechanical processes, we can reduce these antioxidants and enhance our iron bioavailability. And but simple measures such as using citrus fruits juices like lemon juice, or raspberry, or amla, or strawberry like salad dressing, or even in your lunch and dinner, uh, we can enhance the absorption of iron in our diet. And finally, as Achyutan sir introduced that the heme iron is maybe the source of good source of iron, but it has its associated risk, like as he mentioned, that some studies suggested that heme iron can be may be associated with risk of cancer. So while thinking about the while thinking about our dietary choices, we have to think about the food packages instead of the individual nutrients. That would be more helpful when dealing with such problems. And as Sweta ma'am suggested that even by supplementing your pharmacotherapy for anemia and iron deficiency with your diet, you can achieve your recommended dietary intake of iron. I think that's all from today's session. So now I would like to open floor for question and answer session.
Thank you so much. Thank you so much, everyone. We have got some questions. Dr. Sangeeta Masoor is asking, can iron deficiency anemia be a cause of cancer? Mitochondrial damage was mentioned. So would you like to answer Dr. Pratima or Dr. Anjali Nakra on that?
Iron deficiency, I'm not too sure if that can cause cancer. Excess iron is what the studies have shown. I'm not very conversant with that. Dr. Anjali, you can shed any light?
No, iron deficiency, no, definitely not. I've not heard of it either. Excess iron, yes.
Okay, she has mentioned that mitochondrial damage was mentioned. So Sangeeta, can you please clarify, like, who mentioned that mitochondrial damage so that we can ask? Another question is, do low anemia causes joint pain?
Sorry, just to add to the previous answer, in case you're speaking from personal experiences, a lot of types of cancer can cause anemia. So if you if you have anemia, it might be one of the various signs that you might need to do testing for cancer. But as Dr. Pratima and Dr. Anjali mentioned, probably not the other way around. Just thought I'd share it.
Last few months, why I asked this specific question, this is Dr. Sangeeta here, was there was a case of a staff nurse who used to work with me, perimenopausal, and she had a hemoglobin of 8.4, and she was finding it dysphagia for solids. She was not able to swallow only solid food. She was finding it difficult to digest even fruits or even small pieces of solid food. So this case was this thing, and it was found that she had esophageal webs and iron deficiency anemia with esophageal webs. There is a syndrome apparently called Plumer-Vinson syndrome. So this was that is why I asked her. And esophageal webs are finally lead to they are precancerous. That is what was I tried to read through, and I found these things. So that's why I asked her.
Probably in its multiple, I mean, it's involved in the cell divisions, right? So that's where it is known to cause this esophageal web where there is kind of, they're not able to swallow. But that leading to cancer, I'm not too conversant with that. And
Dr. Achyutan mentioned that giving a lot of iron can also can cause cancer. In fact, overcorrection of
yeah, that is known. Excess of iron is known, but less of iron causing that we're not sure.
Yeah.
Okay.
Thank you, ma'am.
So we have addressed all the questions which have been pinned in the chat box. Yeah, please go ahead.
Yeah, there is one question, ma'am, from someone that is low anemia. I think by low anemia they mean low iron can cause joint pain.
Yeah, we have addressed.
Yes, it can. Muscle pain, joint pain.
Yeah.
Even without anemia, you can have And just with iron deficiency without anemia also, you can have muscle aches and joint aches. Many non-specific symptoms.
Okay. So this is a very nice message from Dr. Seela Prabhu. Thank you, everyone. We truly need a group of illuminating and refining knowledge. Amidst the grandeur of medicine, we often overlook the fundamental principle of diseases. This has been immensely helpful to me. So this is the power boosting message for all of us. Thank you so much, everyone. Thank you so much. So before we leave the session, I would like to have one screenshot with all the smiley faces and successful discussion forum event today. So can you please switch on your cameras for for 2-3 seconds. I'll give you 1 minute to just take care of your hair and something like that.
Dr. Shruti, this most difficult part of the whole session you're asking us all to do. How much ever you want, we can talk. Smiling on
I must say thank you all for bearing me today.
Okay, I was liking Dr. Veena Acharya. She was switching off the light and her camera is on. Okay, so one. Okay. 1, 2, 3, and cheese. Thank you.
Thank you.
Thank you.
Thank you so much.
Thank you, everyone. It's been a very enriching experience. I think we've all learned from each other.
Yeah. That's the best part. You read a little bit and the rest everybody will teach you.
Yes.
That's
yes,
good.
that's
Thank you.
Yeah. Okay.
Thank you.
Bye.
Thank you.
Bye.
Bye.
Have a good day. Good night.
Have a good day.
Good night. Good night.
Good night all.